Welcome, everyone. I'm Dick Deming, Medical Director of Mercy One Cancer Center and founder of Above and Beyond Cancer. Welcome to our Cancer Education Series, which is brought to you with funding from the Iowa Cancer Consortium. And you're in for a treat, a dog treat, right? Hey, Gus. Gus, are you awake? Gus, hi. So we have Gus with us and also his masters, owners, parents, friends, Cannady and Jack Fritzjunker, and they are owners and operators of Dog Training Elite. And we're going to spend this evening having a conversation about the benefits of pets, in particular dogs. We'll talk a bit about therapy dogs and service dogs and emotional support dogs. But first, let's welcome our guests. So welcome, Cannady and Jack.
Thank you. Is that close enough?
Yeah.
Yes.
So what was the first dog you ever owned, Cannady? Or that you ever, I assume, did you have dogs growing up?
Always. Never.
Always.
I don't think I was ever without a dog.
What's the first dog you remember from your childhood?
The very first dog I remember is Abraham, who was a German Shepherd. Great dog. Used to try to get on the bus with me every morning. And he would always be we had a really long lane. We lived in the country, and he would always be sitting at the end of the lane when I got off the bus at night. He always knew what time I would come home on the bus. So he was a great dog. I think I probably had dogs before that, but I don't remember.
And Jack, what was the first dog in your life?
Maybe Oscar?
You were pretty little when we had Oscar.
Yeah.
And so what was Oscar?
Oscar was a Cocker Spaniel. I guess I probably remember him more from pictures than anything else.
Okay.
But yeah, I've had dogs my whole life as well. Gus here is my first dog all on my own, basically.
On your own.
Yes.
Right.
So he has a special place.
My first one I remember was that they were Buster and Brownie, and they were American Water Spaniels.
Oh.
So Dad was a big hunter. But the one I remember the most was, and that was Buster and Brownie would have been maybe 6 or 7. But then we had through most of my maybe 5th grade through part of college was Snoopy, who was half dachshund and half black lab.
No.
Yeah.
What does that look like?
And it was not like a designer dog. It was it happened in the backyard sort of design, I think.
Gotcha.
Yeah.
Yep.
Yeah. So when did dog training become your profession?
Pretty recently. I mean, we always, growing up, our family always did like foster care for the ARL and things like that. So we would informally train dogs. We would get them through like the potty training, crate training, sit, just those basic commands, those concepts. And then we would, when they were ready to be adopted, they would, go back to the shelter and go to their new home. So we kind of always, as a family, did it informally. But Jack and I started this business a year ago. So
Okay.
we are officially dog trainers as of a year ago, professional, like with actual training, not just
You're
winging it.
you're trained. You
Right,
have papers.
Right, we do. We have a lot of papers.
Okay.
Yes.
Well, excellent. Well, as you know, in the healthcare setting, we often get graced by having a therapy dog come visit, and there probably are other types of therapy pets, but most common is dogs. And having grown up with dogs, and just you just see the love and joy that comes on a patient's face,
Mm-hmm.
and relaxation. And so tell us a little bit about therapy dogs and sort of the theory behind why therapy dogs bring wellness, or just your own experience with therapy dogs.
Well, they have documented incidents with the way that therapy, or not, they weren't therapy dogs, but the way that dogs interact in a positive way and elevate mood and reduce stress way back to like the 40s. The Red Cross used them for soldiers with PTSD. They also had these, I think they were called relax and recuperation farms for soldiers coming back from the war in the 40s, where they would go and take care of animals. And that seemed to help them recover from, emotional and physical things that had happened to them in the war. So it started way back probably well before that, but that's the first that I could really find in doing the research when I started this business with therapy dogs. And as far as like the benefits, I always have to bring a list because there's so many benefits that I always forget a few. But elevating mood, stress and anxiety reduction. They're starting to use dogs with kiddos getting MRIs just because it's such a difficult thing for anybody that's ever had an MRI or been with a kiddo who's getting an MRI, how stressful that is for them. But the hospitals that are using dogs in the room are seeing just a huge dramatic increase in successfully being able to complete those MRIs because the dog, it helps the kiddo's stress level go down. Comfort, they're using dogs for comfort in like court and in forensic interviews with kiddos who have been sexually abused and just aren't able to really talk about it, but you put a dog in the room and they can tell the dog their story. And so that's reducing their anxiety and helping them perform those interviews. Loneliness, they're using dogs in nursing homes. I mean, we all know that's been probably, when you think about therapy dogs, that might be the most common one that's used is using them with people in nursing homes. But they've done all sorts of studies and research on nursing home patients who self-report like quality of life before and after starting pet therapy and how significantly that has increased their quality of life and their loneliness or their reduction of loneliness by having pet therapy or even taking care of birds. They did a research study on a group of patients that had, I think it was a canary or something, and that even that showed a significant decrease in loneliness and quality of life scale when they do assessed before and after. Memory, dogs can help with memory with Alzheimer's patients and people with traumatic brain injuries. They've shown that they can help with that by interacting with the dog. They're able to remember more things. Distraction, they're a happy distraction. They're using them with people who are like waiting for treatment and during the process of receiving treatment. The dogs are able to just give them something else to think about so that they report less pain and less stress and anxiety going into their treatment.
I think the one thing, I mean, when you have a dog with you in the room, it's just, it's you're with the dog, you're present in this moment. And so what it allows you to do is shut off the regrets of yesterday and the worries of tomorrow and just be present. Hey, Gus, I want to be present with you.
Well, and dogs live in the moment. You know, they're so very in the moment. And I think they teach us how to be in the moment.
We got to show the audience. Yes, wake up, Gus. Oh, it's my goodness. Are you awake?
There we go.
You are so beautiful. So, Gus, what do you like to do?
You're seeing it.
Like you like to lick.
That's right.
He loves to be with people and he loves to nap.
Yeah. Licking, sitting on feet, leaning up against somebody.
If he could sit on your lap, he would be very,
so
very
I've learned
happy.
that Gus is not quite a therapy dog yet. He's a pup that's going to get trained because he's got the right sentiment. Yeah, the right essence there, don't you? Can you show me your paw? Paw.
Do it.
Oh, there he goes.
Here we go. Here we go.
It's hard
paw.
to get comfortable and raise your paw.
There we go. Good job. So tell me about Gus. So Jack, tell me where did you get Gus and what's Gus's heritage?
So Gus is just a mix of all the bully breeds out there. He's probably got Bull Mastiff, American Staffordshire Terrier, American Bulldog. So he's just kind of a conglomeration of all those different thick breeds. I got Gus basically off of Craigslist when he was pretty young. So I've had him most of his life. When I first got him, I didn't really know where he would lie, if he would be a service dog, if he would be a therapy dog, or just a pet dog. And on that note, like when I'm evaluating a client's dog for therapy, I look for a lot of the qualities that Gus has. So his favorite thing in life is interacting with people. I don't know if you guys have noticed, but every time somebody comes in, he'll wake up and he might not lift his head up, but he'll wag his tail a little bit because all he wants in life is to interact with people. And that's really, really important for therapy. Is part of the reason that a lot of people get a lot out of therapy is because the dog is looking for all this attention. You can see like exactly what you're talking about with the presentness, where his focus is whoever is, basically making eye contact with him. So those qualities are really important in a therapy dog. And Gus has got all that. He's got a little bit of excess excitement, and with a lot of dogs that's okay. With him weighing about 85 pounds and it's all muscle, you got to be a little bit more careful. And then also with therapy, you kind of tailor the dog to the environment. So for Gus, like a youth center would probably be the best thing for him because that fits into the environment there a little bit more than like a nursing home or something like that, where you may want a smaller dog. But yeah, with therapy, you just kind of look for.
We would not want you knocking Granny.
No.
So, tell me about how do you all get trained to be a trainer for service dogs and therapy dogs?
Sure. So that's part of the reason why we ended up buying the franchise that we did, is we had an understanding of how to teach basic obedience and stuff like that, but both of our passions lie with helping people. So we wanted to figure out a way that we could do that with dogs. And what Dog Training Elite did for us is teach us the more advanced portion of training. So whether that's therapy, service, or like scent work, all sorts of different stuff. So we went and basically learned how to do all that in Utah. So they taught us service dog task work, therapy dog stuff, all sorts of fun things like that. There's a lot that goes into therapy dogs and there's a lot that goes into service dogs. So it is a pretty complicated and extensive process. Most therapy dogs take around a year to a year and a half of training before they're fully ready, and service dogs are comparable, maybe a little bit longer. But
so let's define those terms. So we've I mentioned 3 different terms: therapy dog, service dog, and an emotional support dog. So how would you characterize and distinguish those 3 types of pets?
So the main difference between the 3 of those is, I'll start with ESA because that's kind of the lowest level of all of them. So an ESA is just an animal that provides emotional support. So technically with ESA, you don't need any training, you don't need anything. They don't have to have like an AKC, Canine Good Citizen test or anything like that. They just need to be a dog that provides emotional support. So basically any dog can be an ESA.
Don't require any obedience. Or
right.
anything.
Yeah. There's no requirements
because they don't have any public access rights. Which Yeah.
And that whole emotional support animal is kind of a little bit confusing and in flux, and not every entity recognizes it. And there's all sorts of stories about, well, I've got my iguana and I need to fly with it because it's my emotional support, and it was hard to come up with real objective rules. I think of the airlines in particular, where occasionally things would get a bit out of hand, and they didn't know where they stood legally and medically. Like, is this, to somebody, are you going to get in trouble with disability laws because you don't allow an emotional support peacock on the airplane or something, and I don't mean to make fun of emotional support, but it was hard to distinguish that. And so I think that they've tightened up a bit more and understand that dogs, because of their long history as service animals and therapy animals, they're probably a little bit more lenient with dogs than with all the other things.
Yep.
Exactly.
Yep. And dogs don't have to have, even service animals don't have to have any identification. And so it is hard. I think it's very challenging for stores and, the airlines and things for a while anyway, because you can't really say, what's your disability? What is this dog for? You can ask if it's a service animal and what tasks they perform, but that's legally the only 2 questions that you can ask. So I think that they had to tighten some things because it was very hard for them to distinguish between just somebody who loves their dog and wants to take their dog everywhere, or somebody who legally has a right to have that dog in public with them everywhere they go because they're performing a task.
Talk about service animals, a service dog, and in particular, what's the definition of a service dog, and how do you train a service dog, and what are some of the tasks that they do for their clients, their owners,
oh gosh,
So there's a lot to that question there. As far as like what a service dog is. It's a dog that provides a task for their handler. So for example, a diabetic alert dog would alert when your blood pressure drops below like 91
Blood sugar, yeah.
or blood sugar, sorry, below 91, or alert at a high level of like 250 or something like that. So what that dog can do is save somebody's life and let them know, like, okay, your blood sugar is dropping right now. We need to do something to fix this. So they're providing some sort of task that aids that person in public. Or on the PTSD end of things, if it's someone who has severe PTSD, the dog can help them, like ground them. So if they're having some sort of dissociative episode or something like that, the dog can provide a task of some sort, like deep pressure therapy, in order to bring them back to reality. So it's things like that that a service dog would provide for them. As far as the training goes, it's a very extensive process. It generally takes somewhere around 2 years or so to get a dog fully through that program, and just depending on what type of service dog it is, kind of changes that process.
And would a service dog for the blind be a subdivision of service dogs, or is that a whole different classification?
I mean, I guess it is in the same theory. We don't do anything with guide dogs.
Guide dogs. So that's what we call it. So if you're a dog for someone who's visually impaired, they call that a guide dog, and that's a different level of certification. Okay.
Yeah, there's a lot that goes into that.
Yeah, the service dogs that we do are mobility, psychiatric, PTSD, personalized autism canines, diabetic alert dogs, and other medical alert dogs too, not just diabetic alert. Other medical alert. Did I leave anything out?
And are there different breeds of dogs that are better for different services?
Yep,
Absolutely.
definitely. So the reason that you see, like with most service dogs, you generally see golden retrievers, labs, and German shepherds they tend to be the best fit for work. But if you look at like diabetic alert, for instance, you'll see different dogs there because it's more of a scent-based thing versus mobility, where you might see like Bernese mountain dogs or larger dogs. So it kind of depends on the tasks that you're looking for. And that kind of determines the breed of dog, basically. But the way that we do our models, we work with dogs that people already have. So we have like pit bulls like him in the program. We've got doodles. We've got all sorts of different breeds.
I see. So your particular business, you'd be more likely that the person already has a dog and you're training their dog that they already own and love to be able to provide a service or provide therapy.
Gotcha. Especially if we can. So we do like an evaluation and all that, but
because not every dog can pass.
It's an elite category. Okay. So there are dogs that wash out, or there are dogs that we just have to say, I'm sorry, this dog's just doesn't have the personality or the drive or the ability to do the training to make it through the program. So we do have to say no sometimes to a dog that somebody currently has. Unfortunately, it's not fun, but.
So I would imagine, but perhaps I'm wrong, that the category of therapy dog, talk a bit about therapy dog, that might be open to a larger breed and maybe a IQ span that's greater than what you need for a service dog.
So therapy is different in a couple different ways. The main difference between therapy and service specifically is that a therapy dog is trained to serve multiple people. So each different time they go into a hospital or something, they're going to be serving someone else. So the way that we train for that is quite a bit different, because a service dog is taught to essentially ignore everyone in the world except for their person. So when you look for dogs, like he would not make a great service dog because he would like to go interact with y'all rather than paying attention to me. It's very hard for him to stay here and not go and sit on everyone's feet. So you do definitely look for different things. And then with therapy, our test is also quite a bit different than a service dog test. So the therapy test is actually quite a bit more difficult than the service dog test, because with therapy, they have to be able to interact with a bunch of different people and also handle crazy situations that may happen whenever you're taking a dog out into public. You can't predict and you can't test for or prepare for everything that they'll be seeing when they are out working. So it is quite a bit more intensive.
So one thing that I have seen is the therapy dogs, they wear a vest when they're on duty. And so they know they're on duty. And I was just amazed. So I have friends that work at Child Serve, and Child Serve has their own therapy dog that 40 hours a week, works
Mhm.
there at child serve, but then it goes home
Mhm.
at night with the child's life specialist and lives at home. Well, I met the dog with the vest on.
Mhm.
And 5 minutes later, they took the vest off, and holy moly, the difference! I mean, it was just so
amazing.
well
Yep.
behaved and
Mhm.
polite and meek and mild. And then they took the vest off, and it's like, I'm Gus. Can I lick you?
Exactly.
It's amazing that how
Yes, Gus,
quickly
we're
they pick
talking
up on
about you.
that, putting that vest
Mhm.
on, or even sometimes certain situations like going out in public, they'll just, even without the vest on, they'll just automatically kind of go into that work mode.
Mhm.
But they very quickly catch on to work mode versus being at home, and they can be. It's almost like two different dogs. It's amazing how quickly they catch on to that.
Right. And Gus is a really good example of kind of the medium point of therapy training, where he's got all the basic obedience in. He can sit here and be relatively polite on his place cot without me having to kind of manage him. But we haven't done much of the kind of out in public or interacting with people portion of things yet. So you can kind of see that middle point with him.
Yeah, this is not a cushy down comforter or a blanket that he's laying on. So this, you can call this
A cot.
a cot, and he knows that okay, I'm supposed to stay here
Yep.
and not get off it and go
Yep.
run around.
Yeah, so this is just one of the basic obedience commands that we teach, and I call it the place command, basically. So he knows he has to put all four paws on this elevated object, and it's his job to stay on there. So that's why you'll see every once in a while he'll get really excited, and he'll kind of fall off it, and then immediately he gets back on because he knows that's where he's supposed to be.
Tell us some examples of. Let's start with service dogs that you guys have trained, and a little bit about their owner and the act of training and how it may have changed their lives.
So I guess as far as the changing lives things go, especially with service dogs, what I see kind of going back to the point of therapy is for a lot of people, just the act of having a dog and having something structured to do training wise every day is about 70% of the battle. So the way that we do our training is we focus on, before we even start task work, we focus on getting the dog capable of being out in public, because for most people, just the act of having a dog out in public with them, especially if you're looking at like a PTSD client or a high anxiety client, that's most of the battle right there. And then we start our task work after that. But for most people, just the act of having something to do with another being of some sort is a big portion of what helps them there.
So you're training the dog, and you're also training the human.
Yes.
Yeah. And how much of the training is all of the training with both the human and the dog, or do you sometimes take the dog for a week to get it instilled in some behaviors, or how does that work?
Yeah, so the way that we do our training is essentially what I do is I teach people how to train a service dog, because in my opinion, having the client with, teaching the client how to do it and me kind of stepping them through each step of the way is the most sustainable way to do it, because what that allows them to do is have the information to uphold that training well after I'm out of the picture. So there's very few situations where I will interact with the dog on my own. I would much prefer to teach them and give them the tools to handle if the dog is overexcited or if the dog's not alerting or doing their tasks. I want them to know how to do that.
So what do you do if like the dog's a good candidate, but the human is like just unable to say no and unable to sort of
that's
Come up against that a few times.
Yeah, that's a tough
Those are tough
situation.
conversations that we've had to have. Over.
Look, your dog's gonna pass,
dog's-
but I'm not sure
but-
you're gonna pass.
Because it is a big commitment and it's a rigorous program, and they all come to a point where they're pretty frustrated because the first 90% that they see a lot of progress in a pretty short period of time, but it's that last 10% that's the difference between like a service and a therapy dog and just a really nice dog, and that 10% takes a year, or 9 months or whatever, and you don't see as much progress, but it's just repetition and practice daily, and so they've just get to the point where they're like, is my dog ever going to get there? I'm just, I'm doing all this work and I'm not seeing a lot of progress. So that's something those are tough conversations to have too, because we have to just keep saying, you got to do your part. You got to keep working at it. And some people, That's hard. That's hard because it's long and it's rigorous and it's monotonous and it's not easy. And it's a huge commitment. So not everybody is a good candidate. The dog might be a fabulous candidate, but sometimes people, just don't have the commitment to get through that program.
So have you ever trained a service dog to be able to bag its own excrement?
No.
yet.
Gosh, if we could do that, we'd be millionaires for sure.
Okay.
I haven't really.
So
Jack could probably figure out how to do that.
Other examples of clients and their dogs that you can describe and the way it had an impact on their lives?
So most of the service dogs we do are for PTSD.
Mm-hmm.
So I have a lot of clients that fall into a very similar category of they struggle a lot out in public. So that's kind of the biggest thing that I see with our service dog clients is the dog gives them the freedom and the confidence out in public to, feel comfortable, to go interact with other people. So I don't necessarily want to talk about clients in specific.
Right, sure.
But that is kind of the big thing that I see with PTSD clients.
Well, and anxiety,
clients.
Reducing anxiety and depression. And it's just, that social, like you have something to do when you've got your dog out in public, somebody to talk to. So it's a way to start a conversation. It just takes some of the pressure off of those social situations, and people who have anxiety and depression. A dog is a great way to get them out in the community, losing weight, getting active, things like that the dog is, because of the training, they have to be working with that dog daily, and they have to be taking walks and teaching the dog how to heel, and all of those things are forcing people who normally might not leave their house on a daily basis, and to get themselves in situations that they normally would have been pretty uncomfortable in, but because of the dog, they're able to go through those barriers.
And I think when people hear PTSD, they automatically think of servicemen returning who had a difficult time. But as you're expanding, it could be someone with very high anxiety level who's just doesn't want to leave the house. Just it's awkward and afraid to be, or feels so self-conscious, and bringing the animal along is, I've got this buddy with me, and if I'm a little anxious about all of these folks, I got my buddy here.
And if you have a dog, people aren't looking at you. They're looking at the dog is the one that's getting the attention, which is a great way to reduce someone's anxiety. It's their dog that they're talking, and I've seen a lot of anxious people who can talk for length about their dog and everything great that their dog's doing. They can't necessarily talk about themselves, but it's just a great way for them to still have some social interactions with people, but it's about their dog, so it makes it easier to do.
Well, let's talk some more about the therapy dog, because I would imagine that that somebody who comes to you says, I want my dog to be a therapy dog. They kind of have this altruistic, they want to help others. Now they know they're going to feel good about it themselves, and that'll be good, but they're probably not someone who's high anxiety and in need of a service dog. There's somebody who is highly functioning and loves their dog, but would love to be able to have their dog bring joy and well-being to others. So that's probably a different type of client dog pair that you train.
Absolutely. No, that's a good point, because they're coming for completely different reasons. Most of the people that we have in the therapy dog training program are very social. They just really want to give back. They want to get out. They love their dog. They love being around people, and they want their dog to love that experience too. And it's a way for them to engage in the community more. So we have a lot of great teams right now. They're about ready to graduate in every kind of breed. And that's the thing too. We're looking not necessarily for dogs that can perform tasks that have to have a certain nose or a certain size for mobility or whatever, but dogs who have that personality, like he's talking about for Gus. And so
what would be some of the things you would do? I've got Gus as my dog. He's 2 years old. He loves me. He loves everybody. I want him to be a therapy dog. What would the first couple weeks of training me and Gus entail?
So the way we start with all of our therapy dogs is just with basic obedience. So I want to make sure that anybody who is taking their dog out into any sort of public environment first has control of them. So making sure that they're not pulling on the end of the leash, making sure that they can, walk properly in the heel, all that sort of fun stuff. So it always starts with the simple basic obedience portion of things. And then usually what we do is we spend some time with the dogs in our group classes. So that teaches the dogs to do all those same basic obedience commands, just now with a bunch of other dogs around and a bunch of other people around. So that really helps. It can't perfectly simulate like an environment like a hospital or something like that, but what it does is teach the dog to work under high distraction. And then after they spend some time in group class, then what we'll start to do is do like public outings, or we'll teach specialized greetings. So with most of our therapy dogs, what we do is we always teach them go make a friend, which is basically their release. And I kind of like to put a point to it so that, if it was you that I'd like to provide therapy to, I'd say, Gus, go make a friend. And I'd point at you, and then he'd kind of wander his way over there. And he'd do his little task of some sort. So usually I'll teach like the paw command, or I'll teach rest. So they come and they rest their head on your legs or something like that, so that the dog has an appropriate way to interact with whomever they're providing therapy for.
And can you give some examples of some humans and dogs that you've trained for therapy?
Yeah, I mean, we have some pictures somewhere of some
Oh,
of the
yeah.
dogs. There's one of a,
Yeah.
it looks like it's in a nursing home. That is Grace is that dog's name, and her handler is
Okay.
Becky. I don't know if you can find that.
Let's
I think
see,
it's
we'll
like, there we
bring
go. Yeah, so that's Grace at work.
Oh, wow.
So Grace is in nursing homes, and she is a lovely little sweet pup, and she's a great fit for a nursing home because she can get up there on their laps, on their beds or whatever. And she's just, she's been able to make a really big difference in the nursing homes that she's been in. You can tell she loves her work, and her handler is an amazing person. All of our teams are amazing.
So, how old would you say her owner is approximately, and how old is Grace?
Grace just turned a year in January, so you can't be a therapy dog
very
until
young.
you're a year. So we had, she was just, I think it was January. So
And-
anyway, so she's barely a year.
And
then
what
her-
did you say her breed was?
She's
like
a
a
mix of like a
cockapoo
Cockapoo or
cockapoo or
cockapoo,
something
maybe?
like that. Yeah.
Okay.
multi-poo. No, I don't know. It's something poo.
Yeah.
One of those.
And her human partner is
Her human partner is
Is
Becky.
Becky.
And did you ask me her age?
okay, she's like in her 50s or 60s.
Yeah, I think
she's
so.
retired. I mean, or
She still
She's-
works,
she
but
still
she does
works.
this. Yeah. And she's
Gotcha.
actually, Grace is has been such a great therapy dog that I think she's going to probably expand past nursing homes and try to do some other,
Okay.
like some hospitals.
and the reason I
and
asked
some
about
schools.
age, I kind of envision that a lot of the people who get into it are retired.
Fair, yes. I would
Yep.
say
Well, and
pretty much almost all of our.
with
except,
most of our, actually, well,
well,
it's kind of split. I would say about a third of our therapy dog clients are somebody who has a mother or a father that's in a nursing home right now. And then a third is someone who works within the school system. So we have like superintendents, teachers,
Oh.
counselors, stuff like that. So most of the people who we get as therapy are someone who works in an environment where they want to be able to take their dog to work and do something productive with
Right.
them there.
we also have a team, 2 dogs that are actually training for the homeless shelter right now. So the handler works at the shelter. And then, so her and her husband are training, and the kids actually are doing a lot of the training too. So those dogs will work full time at the shelter. She'll take them to work with her every day.
Yeah.
And we've been working with them for about a year now, actually. So pretty close to a year. And then we have also 2 other teams that work in residential treatment. And so their dogs will go to work with them, working with teenagers. So we have, it's split up. There's a chunk of retired people,
Yeah.
but there's also a lot of people who are just planning on taking their dogs to work with them full time.
That
every day, which
you
is
know, and
amazing.
I mentioned the child service situation, but you've just described, 4 other
Mhm.
situations where having a dog at work
Yep.
as a trained therapy dog,
Yep.
can be there and provide a great deal of joy and well-being and to everyone.
Well, we have a therapist also that is training a dog to go. She does private therapy, and she'll take her dog to work with her because that's just been proven to be really helpful for people when they're telling their stories to have a dog there in the room.
So let's open it up to questions. We got quite a few people here, live studio audience. We also have people live streaming who can put their questions through our streaming service.
Yes.
Questions for Cannady and Jack or Gus? Yeah, Gus is ready to answer.
What do you think, Gus?
He's very quiet.
He is a pretty quiet dog. He's not a barker or
Uh-huh.
anything, no, or a growler. He just hangs. Just hangs out.
So how many dogs or pets do you have at home, Jack?
I just have Gus, and then I have a Belgian Malinois as well, Freya.
A Belgian
Malinois.
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 Malinois. Yes,
It's
the French part of Belgium.
they're the dogs
Yes.
that you always see in the military. They're like jumping out of planes and doing search and rescue. That's what kind of that probably helps. They look
A
like
little
small
bit
shepherds,
like a small
Yeah,
German Shepherd.
small little
Yeah.
petite
yeah.
shepherds. Yeah, she's an amazing dog.
Okay. And what about you, Cannady?
I have 3. I have a corgi, who's one of our work dogs, and then I have 2 pit bulls, who were rescues, who, have a lot of issues. As you know.
Yes. We have questions back here. Do I have the extra microphone here? Okay,
Oh, you
here we go.
Hi, my question is for owners who are working with you to train therapy dogs, what would you say is the one biggest piece of advice or maybe the biggest mistake or hurdle that you would just want people to be aware of to overcome when training a therapy dog?
Probably early socialization. For most dogs, that can be the biggest hurdle to jump over, because basically with younger dogs, if they don't get out and about and kind of learn that new experiences are fun when they're young, then a lot of times you'll see reactivity or you'll see anxiety come from that, because they just have never learned how to take on new experiences, basically. So with a lot of stuff, it does start at an early age, and you can do a bunch of different things to help them out with that, essentially. But the biggest thing is just lots of new environments, new stuff there.
Yeah, I have a quick question for you. You're talking about therapy dogs. Are dogs the best candidate animal for therapy? And is there like therapy cats or birds and things like that?
There's therapy guinea pigs and therapy. I've heard of a therapy duck. I've never seen the therapy duck, but cats. There's cats, rabbits. There's a lot of horses are used for therapy. Yep. So there's a lot of different animals that have had a lot of success with therapy. We just love the whole dog thing. So
Is
of course.
dog the best candidate?
So
I mean-
I would guess so. And the reason that I say that is because for most people, you've interacted with a dog before. So on the therapy aspect of things, there's a good chance that when you were a kid, you had a dog that you liked, or your neighbor had a dog that you liked, or something like that. So my guess is it pulls from some of those memories when you were younger.
Mhm.
And then the act that dogs, they've been evolving with us for a long time. So they do have intuition as far as like our emotions and what that means. So my guess is, as far as candidates go, they're just the most intuitive as far as therapy would go.
Yeah, they know when to go in and when to step back. I was a social worker for 25 years before I started this business. So I've done a lot of work with therapy dogs through the years, and they just intuitively know when a kid is ready to open up, or when a kid needs a little bit of space. It's just amazing to watch. So I think that they are maybe the best candidate, but we could be a little biased too. I know there's great therapy animals out besides dogs. I think horses have a lot of intuition also, from my experience with them. So.
Yeah,
Sorry.
it's hard to get them in the elevator.
I know, right?
Do you have a question?
Yes. Have you noticed with the therapy dog that they tend to lick people's fingers that have like neuropathy? Because I have neuropathy, and every time I meet a new dog, they come up and lick my fingers.
Huh.
And if I don't have shoes on, my toes also.
Wow, I
Interesting.
have never noticed that, but I will
Yeah.
now pay attention just to see
Yeah,
if I
gives us something to look for.
Yeah. Huh. You could have
I'm
him-
sure he would love to lick your fingers.
Gus,
And
do
your
you want to
toes.
lick Poon's toes? Would you lick her toes? Yes. He's ready, Poon. Yes. Yeah, here you go, Poon.
Oh, he's really smelling them, isn't he?
Yeah.
Yeah. Well, there you go.
Oh, oh. I did not know that, but that is, I've never read anything about that, but
Yeah.
I'll
If
have
you
to
guys
look
have
that
talked
up.
about glucose levels of the dogs, noticing the difference in
Mhm.
change. I had a dog, it was a lab spaniel mix that back in the day, it was my college dog, but he could tell when my mom's had a blood infection when she was septic
Mhm.
and before anyone else noticed right away. So there were a couple of times where it was his command, his just the way he reacted was just something so strange. And we would call the doctor and get her in, and one time it was almost a year in a different from. We didn't realize her infection was back, but it was the dog that actually
Mhm.
sniffed it out as soon as he walked in, and it was like a crazy thing that he did. But and then have you gotten do any of your clients do like reading groups? I've had quite a few friends that they go into schools with their therapy dogs, and children that are little dyslexic and don't like to read out loud or stutter. They work with a dog, like one particular dog every week, and then they become reading and like to speak out loud. So
Yeah, I've definitely seen the studies and witnessed it too, how
Yeah.
dogs can make, just kids more comfortable about communication and reading. We have a couple, like we said, a couple of teachers, guidance counselors, administrative staff that are training their dogs. I don't know how those dogs are going to be used in the school, but I would imagine that they're going to get them in front of some kids like that because he wants to talk.
So you mentioned, the service dog for the diabetic, and so if they recognize that there's hypoglycemia and the handler, the human, is foggy and not, what does the dog do? Call 911?
So usually what we do with stuff like that is we set an alert before they get to that stage. So like with people with diabetes, usually it's at 91 where they set that alert so that we can stop that from happening before it gets to that
To
point.
dangerous levels, yeah.
With most dogs, what we teach our diabetic alert dogs to do is be really, really persistent. So even if you're ignoring the signs, we teach them to get more and more persistent with it. So there's some dogs.
So then
that
the handler recognizes the dog is
Exactly.
telling
Yep.
me
So
I
there's-
need some sugar.
Yeah, we have some dogs who will gut punch or they'll like bite on the sides or whatever. So we teach them that they need to go.
What other medical conditions like that where you're asking the dog or you're training the dog to look out for a particular condition? I mean, seizures is probably too late, or unless they can detect
Seizures
pre.
is a really difficult one to train for. Most dogs, like if I have a seizure alert dog, they're already doing that before we start training, because that's something where scent-wise we don't necessarily know. Basically what we have to do is before, if you can get it, or after a seizure, we take a scent sample, which is basically just taking like a dental roll, putting it in your mouth, chewing it up, and making it really gross, like a spitball essentially, and then using that to train for the scent. But we don't know what the dogs are smelling there, so that one's a little bit more challenging. But we also have dogs that will smell blood oxygen levels. We have a client who's a little 6-year-old boy, and his blood or his oxygen levels will drop. And basically, what the dog does right now is whenever he smells the oxygen levels going too low, he will go and stop the little boy from playing, make him sit on the ground until he's fine, and then he lets him back up. So there's a lot of really, really cool stuff they can do with scent.
We have a question over here.
When you mentioned about diabetes, I'm a type 2 diabetic, and I have to wear a sensor now and have to constantly check myself, and scared him a few times because I have a hypopen, because it can go as low as to 50. And so what qualifies a person to get a dog for that?
Yeah.
That's
already qualified.
Okay, Dr. Demi. Another good reason to get a dog.
And all you really need to work with somebody is just proof of a diagnosis, whether that's a medical issue or a mental health issue or whatever, anxiety, whatever that is, and then a good candidate for a dog. And then that's, yeah.
So you raise a good question, and maybe part of the underlying question is, okay, a person has a condition that is that justifies a service dog, I pull out my prescription and I write one service dog. The question I'm getting at, does insurance provide any support for that? Because obviously you need to buy the dog, you need to train the dog, you need to take care of the dog. That's not an inexpensive undertaking. So
No.
have you ever been involved with trying to write letters of justification for insurance?
We have tried. People have tried. There's currently people trying. There's vets that are working, with the VA to try and get reimbursed for service dog training too, but we have not had any luck.
Probably more likely, and I'm just talking off the top of my head, I don't know, but organizations, not-for-profit organizations that provide support
Yep.
for especially service dogs. I don't know about the VA, whether the VA has any programs to provide some support or.
Not that
We
we've
haven't
seen,
had any luck.
unfortunately.
We do have a partner foundation that we work with, the Malinois Foundation, that will provide funding for people. And then we also have a couple other resources for Diabetic Alert funding for people that who want a Diabetic Alert dog, that they will pay for at least part of it. So there are some resources out there, but none of them are coming from like insurance companies or the VA. They're all coming from nonprofits.
Hey, Jack, I'm going to put you on the spot. Why don't you show us a little bit of training with Gus if he's up for it? And I don't know, just whatever you want to walk him through some paces of things you've already trained him, and maybe we can just see
He can
you
sit
in
on the
action
chair.
as how you train a dog.
Sure. So Gus really just has the basic obedience stuff. As you guys have seen right here, he's got the place command down pretty well. So for him, or for me, what the place command is, it means that he puts all four paws on something elevated. So for him, what we can do, Gus, here, good boy. Okay, place. So it's very versatile. It can mean anything and everything that I point to that he can jump up on. He can get up on here. My guess is he'll slide over the top and probably fall off. So we won't do that. The other commands we have are just like sit down, fun stuff like that. And then the heel command as well. Here. Heel. So the heel command just means that it's his job to follow me around wherever I go, or offer up other commands as well. So this is one of the things that you see with training as well, where once you start to build a repertoire, the dogs will start to go ahead of you because he knows the game. When we do demos and stuff, he knows that there's going to be a place command. I just told him that was place, so he's going ahead of me, which I personally don't enjoy. I'd like him to wait for me, but he is still in training, right, buddy?
How old is Gus?
Gus is a little over 2 years old.
He's still
Yep, he is. He's still young, and most of my training, if I'm being honest, goes towards my Malinois. He needs about 2 hours of work every single day, so he has fallen a little bit to the wayside with that, right, buddy? But he gets to go to daycare at my mom
He
and
hangs
dad's.
out. I'm in the
And,
office all day, me and Gus, so he gets to hang with me all day while Jack's out training.
Good boy. Down. Sit. Here.
And
And
so
he
most
does-
of the commands are verbal, or are you doing?
Yeah. So the reason that I don't tend to use hand commands is because if the dog's not looking at you, especially in distracting environments, they probably won't see it. I teach a lot of my service dog clients to use both, but I always make sure that the basic commands are just vocal because he's got pretty good hearing, right?
Very good.
You don't use like a clicker. I've seen the.
No, so we do a lot of different stuff. Like with service work, we use an e-collar for our training, for the basic obedience stuff, and then all the task work, same thing with therapy, is all tree training type of stuff. So we use a variety of different methods. Each dog needs something different as far as training goes. So basically, I know how to teach or how to train with all the different tools, and I just kind of adapt to whatever the different dogs need. So like service dogs get quite the different training style than like a general basic obedience dog would get. Therapy dogs get a little bit different as well. So it just kind of depends on the dog, the handler, the scenario. There's a ton of different factors there.
Anybody in the room ever visited by a therapy dog when you were in the hospital?
My mother was. It was interesting. And I mean, we've been around dogs and all kinds of animals. And the therapy dog came in And I go, look, Mom. She goes, yeah. And she was talking to the purple bear that I bought her. I'm going to put you in a different room here. And it was like the dog was just so kind about it and just like, came over to me so I could pet and then went off. I mean, I was glad that the dog didn't take offense, but I'm sure
That's what's great about dogs.
But I'm sure you come across it. Sometimes they're not, some people are not receptive to
Mhm.
you.
Yeah, not everybody for whatever reason. You know, maybe they had an experience when they were younger or something that they're scared of dogs or whatever. So obviously they're not good candidates for, they won't enjoy it like
or
the rest
they're
of us.
just, in pain. But sometimes even a patient who's not responsive for a dog to just
Mm-hmm. Mm-hmm.
lay there, body contact,
Yep.
the having another warm-blooded,
Mhm.
alive
Mm-hmm.
entity with you, even if you're not, playfully
Mm-hmm.
interacting, can be therapeutic.
Well, and it's well documented that just petting a dog reduces blood pressure, decreases your heart rate, slows your breathing. I mean, just all of those, things that happen just from doing this, just such a simple thing, and that dogs love to do.
I was a therapy partner with my Great Dane.
Oh,
Um,
awesome!
So we did nursing homes and mentally challenged
Mhm.
people. One thing that was really nice, everyone thinks the small dogs are great for older people, but a Great Dane is amazing because they don't have to bend down to pet
Well,
them.
their head is
Their
at the
head is
perfect
right
height.
there. Anyone in a wheelchair that's they were always able to pet my
Yep.
very large
That's a good point.
dog.
Mm-hmm.
And she didn't jump, and she wasn't a jumper ever. So it was a good mix for
That's a really great,
really calm people. So
We have two Danes in training for therapy right now, or just one. Actually, the other one hasn't started, but we're really excited to get them out because you don't see them out they're not very common dogs.
No,
and so to
no,
have, they're just great.
amazingly pretty, usually
Mhm.
very calm.
They
people
are.
that wanna do
Yep.
it.
Yep. So we're really excited about that.
Any other questions for Jack or Kennedy? So before we bring it to a close, if individuals have a dog that they would like to train themselves and their dog to be a therapy dog, how would they get in touch with you?
I actually have a slide I have some cards, but we
We'll put that up.
we have a website, dogtrainingelite.com. We also, you can email me. We have, you can call. There's all of our contact information. I also have some cards up here if anybody's interested, and I can leave them too. So,
And what's an average amount of time it would take? Let's say it's a dog that's fairly well behaved, and the dog and the handler know each other quite well. Is there an average amount of time it would take to get certified?
about a year at
About a year.
least, probably.
And that would be
Yeah.
one day a week. It would be, with you. Obviously, they need to work
Yep.
every day.
Yep.
Okay.
So yeah, we do our training like with basic obedience stuff. It's just one appointment a week. I let you guys, practice for 7 days, come back, teach another command, and kind of advance it that way. And then we hold 2 different group classes every week on Wednesday nights and Saturday mornings. So basically, with therapy, it's about a year of once a week you're going and getting some sort of face time with me or one of my other trainers.
And if someone has a service need, would they need to have that documented before beginning the process, or you help them with that? Or
we can just talk through that when they come. We always offer a free evaluation where we meet their dog, talk through what the program's going to look like, what the expectations are of the dog and of the handler, and then we kind of figure out what the next steps are as far as if we need to get that letter, if we need to call, write something down for the doctor or whatever it is. So yeah,
Okay.
it's just different for everybody.
Any final words of wisdom? Gus?
Gus, what do you think?
Gus, can you?
So Gus waited for another convenience.
Oh,
There we
thank
go.
you.
Ended with a kiss. So, Again, thanks everyone for coming. I'm Dick Deming, Medical Director, Mercy Cancer Center. Thanks for being here for the Cancer Education Series. If you know somebody who might benefit by listening to this and couldn't attend either live stream or in person, this will go on the Above and Beyond Cancer YouTube channel tomorrow, and it will also be housed at the Mercy Cancer Center website so that you can view this on demand. I hope you join us again next week. Thanks, everybody.